Hello friends, I'm Dr. Jeevan Joseph from Jeevan's Diabetes and Endocrine Center. I'm a consultant endocrinologist and the director of Vimala Hospital at Ettumanoor at Kottayam, Kerala. We know that one of the big problems that patients are currently coming to us with is fatty liver. There's so many people who are being diagnosed with this condition. Previously, people thought that this was not of any major concern, but we now know that fatty liver, or its scientific name is MASLD, is the cause now for many metabolic conditions that lead on to developing diabetes. Fatty liver can lead on to fibrosis, can lead on to cirrhosis of the liver, liver cancer, and many patients require transplantations, etc. In fact, it's becoming one of the leading causes of liver-related problems in the country. It's closely linked with obesity and excess weight, and most people who have diabetes, especially type 2 diabetes, have fatty liver. Many of you may have had this diagnosis when you've had an ultrasound. Ultrasound is a very common investigation these days, and many of you would have been told that you have fat in the liver, and there are various stages and grades of fatty liver, various stages of fibrosis, and so on and so forth. The aim of this video is not to speak about fatty liver per se, but to tell you about a natural treatment that all of us can use in our day-to-day life to reduce the risk of fatty liver progressing to fibrosis and progressing to cirrhosis, etc. Now, there are so many treatments in modern medicine itself for treating fatty liver, like resmetirom, injections like semaglutide. We use tablets like pioglitazone, vitamin E tablets, and so on and so forth. But most recently, there's been a lot of evidence that a simple cup of coffee is a great source of polyphenols and antioxidants like chlorogenic acid, which have been found to be very useful in reducing this risk of fatty liver. So how it works is that coffee can help in actually reducing the fat in the liver. It can help the fat in the liver from progressing to fibrosis, and even in those people who have cirrhosis, it can prevent or reduce the risk of hepatocellular or liver cancer. Now, this is not a 100% foolproof strategy, in the sense that please don't abandon any other treatment that you're doing and just go for drinking coffee, but it's very useful, and it's now been recommended by the European Association for the Study of the Liver and the American Association for the Study of the Liver, that people with fatty liver or with various stages of this condition should drink, if possible, and if there are no particular contraindications, should drink at least 3 cups of coffee. Now, if you think that you've been doing this, please listen carefully to the next part of the video, because I'll tell you how you need to do it so that it can be useful for you. First thing, it has to be black coffee. You can't have milk with it. The reason being that if you add milk or cream, it will bind with these antioxidants and make it harder for the body to absorb, and basically cancels out the benefits of coffee. So it has to be black coffee. It's recommended that in people with diabetes and people who are overweight, etc., you should have unsweetened black coffee, because obviously you know that if you put a spoonful of sugar, it can cause a spike in your blood glucose levels. And if you're having 3 or 4 cups of coffee and having lots of sugar in it, that's not going to be useful for you. So the best option, the ideal option, is that you have black unsweetened coffee, but that can be sometimes a little unpalatable. So 0-calorie sweeteners are okay, and I would recommend that you use natural 0-calorie sweeteners like stevia, or even better, the monk fruit powder. Monk fruit is now available in powder form, and that is a natural sweetener that you can use. So if you want to drink that coffee, black coffee, which is having a little bit of a sweet taste to it, then you can use these 0-calorie sweeteners. That's fine. Now, sometimes patients ask whether it has to be instant coffee or should it be filter coffee. Is there any difference? And actually, in terms of their effect on the liver, there's no real difference. You can have the same effects, the good effects are there even if it's filter coffee or even the instant coffee. So that's no problem there. Now the next question that usually you might ask is, if you have some trouble having caffeine, then what can you do? So the research would seem to suggest that decaffeinated coffee also has beneficial effects on the liver. So if for any medical reason you are unable to have caffeine, you can select decaffeinated versions of the coffee and still enjoy these benefits that it gives. It's important to recognize that generally the safe limit for caffeine is around 400 milligrams per day, and generally if you have around 3 or 4 cups of coffee, you will be well within this limit, unless you are having big jugs of coffee or something like that. So about 100 to 120 ml drinks of coffee should be fine, and you should be well within this limit. Now, if you are somebody who suffers from anxiety or irregular heart rate and things like that, where your doctor has recommended that you should not be taking caffeine related drugs or caffeine related beverages, then you can go for the decaffeinated version of the coffee. Now the next question is, how many cups should you drink? And generally the recommendation is that you need at least 3 cups a day to get the benefits for your liver. So generally what I would do, and I do this personally as well, because you can, when you know that coffee has these benefits, it's good to use it. So I've gone from drinking tea to drinking coffee, and I use black coffee, but using a monk fruit sweetener, a 0-calorie sweetener, so that I stay on the right side of the taste, but at the same time I kind of have all the chances of reaping the benefits of using coffee. So this is something that you can easily inculcate into your normal routine, and there are so many people who are suffering from various grades of fatty liver, and this would be an easy way of actually helping your treatment, not being the exclusive treatment. Of course you have to listen to your whoever is your treating physician, and if they've given you other medications, you should take them, but this is a very simple step that you can take and can boost your chances of ensuring that fatty liver does not turn into something serious. Thank you very much.